It's time once again for another episode of the Law and Medicine Show, being sponsored by the law firm of Princenthal and May. Broadcasting live from the Pro Business Channel studios in Atlanta. And now please welcome your host and their guests on today's episode.
Good morning, everybody. This is Attorney Matthew Wilson. I am a partner at the law firm of Princenthal and May, a personal injury, wrongful death, workers' compensation practice, and this is the Law and Medicine Show. It's a half-hour program where we look at the interplay between law and medicine. And over the next 30 minutes, we're going to take an in-depth look at the relationship between personal injury law and medicine. Namely chiropractic medicine, as well as neurofeedback, which you're going to hear about in depth from one of our guests. So as it relates to the law portion of the program, I'm an attorney. I've been practicing here in Atlanta for the last 9 years. Grew up in Gwinnett County. I went to the University of Georgia for undergrad, law school at Mercer University in Macon, and my practice is exclusively devoted to personal injury, wrongful death, and some workers' comp. Most of what I do is car wrecks, slip and falls, that kind of thing. But enough about me. Joining me today are my esteemed, well-qualified, well-credentialed guest, Dr. Donald Capoferri, who's a chiropractor specializing in spinal trauma, and he's been practicing for the last 34 years. He has a practice here in Norcross, Georgia, called the Spine and Injury Center. And also Melissa Hergert, who is a certified neurofeedback specialist, and she's the owner of B Wellness Center in Marietta. Good morning, everybody. How are y'all doing?
Good morning. Doing great.
I appreciate you joining me this morning. Dr. Capoferri, why don't you start us off? Tell us a little bit about yourself, your practice, who you are as an individual, and just what you do.
Well, I appreciate the introduction. Most of the people that listen to my last name realize I'm not originally from Georgia. I am from the South, though, of New Jersey. Rutgers undergraduate, Pennsylvania College of Chiropractic, moved to Georgia in 1982. Some of the listeners probably weren't even born at that point in time. But for 34 years, I've been...
I was born that year. So.
You were, that
yes,
year.
Yes,
I feel much better now. Thank you, Matthew. I've been the clinic director of Spine and Injury Center in Norcross. It's located right at the corner of Spalding and Holcomb Bridge Road there. And over the last few years, I've chosen to specialize in spinal trauma because I enjoy helping people that have been injured. Appreciate
that. Melissa, tell us a little bit about yourself, how long you've been in Atlanta, what you do, how your practice may be a little bit different than the run-of-the-mill medical provider.
Sure, yes. Melissa Hergert from actually San Diego, California, and I've been here going on 9 years. So I moved here to actually attend Life University because I thought I wanted to be a chiropractor, and had a background working for chiropractors, front desk, back office, just in the natural health field. And I actually met Dr. Capoferri 4 years ago, and that's where I learned about neurofeedback, what I do now. And when I moved back to Marietta from Duluth, I opened my own office, and my whole center is focused around the neurofeedback therapy. So inside I have massage, acupuncture, infrared sauna, but my main service is working with children up to adults with their brains.
All right, and we'll get into that in a moment.
Sure.
Before I give you an opportunity to brag on yourself, you said you've known Dr. Capoferri for a while. Is there anything you can tell the audience about him and what kind of medical provider he is?
Amazing. I have actually worked for many chiropractors since I was 19, and I was actually born in 83, but I still know quite a bit about working for chiropractors. He's one of the best I've ever worked for, honestly. His technique of chiropractic, his thoroughness of chiropractic and taking care of people, and his education, not just for his clients, but for the people that work for him, is so amazing. He actually changed my life by introducing neurofeedback to me.
Doctor, do you take her everywhere you go, or are you just bringing her here today?
First of all, I'm used to being the oldest guy in the room. Let's just get that out of the way, okay? Right about the time Melissa came to work for us, I was introduced to neurofeedback by an esteemed colleague of mine, Dr. Guy Annunziata from Hilton Head, South Carolina, who I have the utmost respect for. And Melissa was working for us at the time, so we brought everybody to the seminar, and she took the ball and ran with it. So that's awesome.
Well, good deal. I'm going to give you an opportunity to brag on yourself now for a little bit after we've spent the first 5 minutes doing that with other people. But so it's my understanding you have some familiarity with neuroradiology.
That's true.
Okay. And you also have, you've completed a fellowship in neuroradiology, is that right? Okay,
yes.
So it's my understanding that's pretty unique for a chiropractor to have a specialization in neuroradiology. So tell the audience what neuroradiology is and just generally how that training helps you better treat your patients.
In the world of radiology, radiologists fall into basically two categories. So it's a general radiologist who goes to medical school and then chooses the specialty of radiology, and he'll do 24 months after to get specialized in that, certified in that, and then he'll come out and read the entire body, nose to toes. Neuroradiologists choose to do an additional residency in brain and spine only. For our audience, the difference is pretty big. A general radiologist, according to their own journals, has a 40+% error rate in reading the spine, especially for disc injuries, where a neuroradiologist only have 5% error rate. It is kind of unique within the world of chiropractic. I was the first one to receive a neuroradiology fellowship, and when the opportunity came to me, just to put it in perspective, if you were into baseball, let's say, and you wanted to learn how to hit, and you had the opportunity to learn from Babe Ruth or Rod Carew or somebody like that, would you jump on it? I absolutely would jump on it. It was over 1,000 hours of study, including publishing within neuroradiology. I had to do on-site at Stony Brook in New York, where radiology was invented, and I was personally taught by Dr. Robert Hyster, who is the head of the department there at the hospital, who studied under the man that invented MRI. So it was quite the experience.
So how does having that 1,000 hours of training make you a better doctor at getting your patients better? Why do I want to send my client, or why do I as a patient want to come to you, a doctor with a neuroradiology fellowship, versus some other guy or gal down the street without that training?
Well, the first step to getting better is always an accurate diagnosis. So that's what our motto is at Spine and Injury Center. Accurate diagnosis, prognosis, and treatment plan. So whether the person was referred by an attorney, called us from our website, service is still the same. We will find what's wrong with that patient because we miss nothing. So I'll give you an example. We had a patient come in the other day from another doctor who was not responding to the treatment. And they had MRIs already, they had x-rays already, but what it turned out was the MRI was not taken properly. The imaging, which in MRI is called a slice, they were taken too far apart. They were cervical spine taken at 5 millimeters, which if you take a 5 millimeter slice and then skip a millimeter or two in between, basically you're missing most everything you're looking for. So we had to have the MRI done again at 2.5 millimeters. We found the herniation that was missed on the first MRI. And now the patient's able to get better. Turned out that was a surgical referral, but nevertheless, that was missed the first time around. And it was my neuroradiology training that allowed me to notice that that MRI was not taken properly. The radiologist can only read what he sees, so it wasn't their issue. It was the person who ordered it. There.
So how would your treatment recommendation vary from, let's say this person came to you, obviously was symptomatic, but there was no indication that they had any herniation in their disc or in their back, and then suddenly you find that herniation. How does that change the patient's prognosis, but what you do to help them get back to maximum medical improvement or where they were before this particular incident took place?
Well, again, back to our motto, accurate diagnosis, prognosis, and treatment plan. So the diagnosis on this patient with the previous MRI was sprain strain. You've probably seen that quite a bit in reports. After the MRI, it was disc herniation with radiculopathy, and what that means for our listeners is the disc was pressing on the nerve. In fact, it was compressing the nerve so severely that we had to send the patient to a neurosurgeon. So accurate diagnosis, prognosis. The treatment plan was they needed to be triaged to somebody else as opposed to being treated for a sprain strain, which we would have probably done that in-house.
So one of the things, since this is the Law and Medicine show, let me just talk about some things I experienced in my practice as an attorney and see if how you can offer a solution. So typical case, every chiropractor, every doctor, every attorney has seen an instance where you've got a MRI taken post-accident, fall, whatever, where it's just a bunch of mainly chronic issues, degenerative disc disease, that kind of thing. But then you have a bulge or you have a herniation. The defense is always going to be, whether it be an attorney or whether it be an adjuster that I'm dealing with, that everything was chronic in nature, that there's no way this is acute, there's no way to tell this is acute. Is what the adjuster and the other lawyer or the defense lawyer telling me or trying to sell eventually to a jury correct? In other words, is it possible with your training to make a determination as to whether a herniation is chronic in nature or is acute in nature and can be directly related to some type of trauma?
Absolutely. All we do is apply the rules. We don't write the rules. We just apply the rules. And the rules come from literature. In the literature, there are basically 3 ways to age date a herniation. And let me just clear up some terms. Bulge and herniation are not synonymous. A bulge, by definition, is old, a minimum of a year old. The appearance on an MRI of a bulge is completely different than a herniation. In a bulge, the disc will grow in all directions. Most of the time, it'll grow 360 degrees around. The definition of a bulge is at least 50% of the disc is enlarged. A herniation is focal, 25% of the disc or less. And there are 3 ways to age date a herniation to tell if it was pre-existing. The first one is onset of symptoms. You simply, one, ask the patient and also check their medical history of whether they complained of radicular pain that shoots down a nerve, or numbness or tingling, all nerve-related symptoms, prior to the accident. And is there any record of that? So I have a fantastic staff, and in that regard, they will go back as far back as they can in a person's medical history, getting records from their primary care physician. We've even got records from pediatricians to show that this person in their life has or has not ever complained of that particular symptom before. So it's not just their word necessarily, it's the medical record. The second way is the presence or absence of something called strategically positioned osteophytes, or bone spurs. On an MRI, when a disc bulges or herniates, it traumatizes the bone, and the bone response to that is to grow bone spurs. On an MRI, it takes 6 months for a bone spur to be visible. And the bone spur has to be strategically positioned. So if I'm looking at an MRI and I have a central herniation and a central bone spur of the same size, that's at least 6 months old. So then you go back to the accident date, right, to see. If you have a right herniation and a central bone spur, that herniation's new. It's less than 6 months old, because the body will always grow a bone spur where there's a herniation to try to protect neurological elements. And then the third way to tell is to look at the shape. Disc herniations and disc bulges look completely different on an MRI. So shape, onset of symptoms, strategically positioned osteophytes, age dating herniations.
Using that skill, how can you help an attorney, who in turn is trying to help your patient, recover compensation from the negligence of somebody else. How can I, as the lawyer, use you to help me?
It's all about helping the patient. That's what you said. And when a patient comes in our office, this is what we owe them: accurate diagnosis, prognosis, and treatment plan. So we give continuing education seminars to attorneys 2 to 3 times a year. And the last one I produced, I was asked at the end, I always have question and answer at the end, a plaintiff-oriented attorney asked me, how do you know there aren't defense attorneys in here? And I said, I don't care if defense attorneys are in here, because we're all about the same thing. If you want to know what's wrong with your client, our office is the best place you can send them, because we miss nothing. But we don't make stuff up either. So we follow the evidence.
Gotcha. Mm-hmm. How can people find your office, doctor?
Website, it's drcapaferry.com, or phone number 770-448-4742.
So, Melissa, you're up now.
Okay.
I know when people think chiropractic or alternative medicine, I've always thought that, like Dr. Capaferry, people are treating spine, the neck, mid-back, low back, and that's really it. But it's my understanding that your practice offers treatment or rehabilitation for the brain. So tell us how you got into or became interested in treating the brain as opposed to treating other parts of the body.
Right. So like I mentioned before, I started working for Dr. Capaferry and was introduced to neurofeedback. And neurofeedback is a psychology-based therapy, and I did some psychology in college, and it just sparked my attention. And what was the most amazing, like Dr. Capaferry said at his office, the client is always what the focus is. So when I saw people getting better, coming off medications, coming down off doses, just regaining thought processes again, things like that, cognitive function, it excited me. So that's how I just got into it.
What exactly is neurofeedback? I mean, I guess I know a little bit about the brain, but typically, I know things that neurologists have told me.
Right.
So first of all, what is it?
Okay.
And how is it different from traditional medicine?
Okay, so the best way to describe neurofeedback is an exercise for the brain. So when a person comes in, I'll just go through the process. A person comes in, we do a quantitative electroencephalogram, which is short QEEG. And this is an assessment. So we don't diagnose anything as a neurologist would do. We're just assessing how the brain is firing. Is it firing too fast, too slow? Which areas might be having a little bit of trouble firing at the speed they should be? So that's what the QEEG tells us. It gives us about a 13-page report showing us those different areas and the different magnitudes of different brainwave patterns. So that's what we do on everyone, no matter what, when they come in.
And so you come in, or I would come in as a patient, you would get a baseline of my brain, and let's say I'm subpar. I'm almost certain I would be. What do you do from that point forward once you come in and you realize there's some dysfunction, for lack of a better word?
Right. So neurofeedback is based off operant conditioning. So what we do is we take that report, we find out what symptoms are correlating to those different speeds in the brain map that show up. So let's say there's a child with ADHD that's been diagnosed by their psychiatrist or pediatrician, usually the psychiatrist, diagnosed, and we do that brain map, and we'll see a lot of times in the frontal lobe, it may not be firing as fast as it should be. So that's why a lot of children, adolescents, adults take stimulant medication, because we want that brain to be firing faster so they could focus and concentrate. So instead, we use neurofeedback, or along with the medication many times, we use neurofeedback to help the brain recalibrate itself to fire faster. And the way we do that is hook up sensors to the scalp just with some paste. Everything is non-invasive, no electroshocking, nothing like that. Just sensors placed on the scalp they watch a screen in front of them. So every time the brain waves go into a faster speed, they're going to get a reward on the screen in front of them. So the reward might be a Pac-Man eating the dots, or they're watching their favorite movie and the screen is nice and bright for them. But every time they go into those dysregulated patterns, maybe the slower patterns, the screen will turn black, or if they're playing Pac-Man, the Pac-Man will stop. So it gives a live feedback of how the brain is operating.
And how does that, once you give that feedback, how do you go about improving the speed at which those synapses are firing?
Right. So that's where the neuroplasticity comes in. That's where the recalibration of the brain comes in. So it's a natural process that the brain goes through. So it's kind of like learning how to ride a bike. You never forget. So once you learn that neuroplasticity that has happened in the brain keeps the brain moving, you could get better at riding a bike, but most people never forget. So as you're learning this new way of processing in your brain, it starts to form these new pathways. So that's why it's not a one-time visit. You come and it's just like exercising at the gym. You're strengthening the brain to work in a new way using the science of neuroplasticity.
And how long does that typically take for someone to strengthen their brain? How many sessions would it take for me to come in and let's say I was abnormal and come in and then suddenly I'm where I'm supposed to be, or perhaps even better than God wanted me to be?
Right. So everyone is different, obviously. There's different symptoms that arise. The research, 40 years of research behind neurofeedback have shown 20 visits is usually a minimum amount. That might be someone maybe that just has to deal with some stress. You know, they're pretty healthy. They're dealing with stress in their life. They do 20 visits of neurofeedback. They're able to deal with the stress better, things like that. Someone maybe with ADHD or on a lot of medications may need 40 visits or more. So it is a process, but it is a change that happens in the brain that becomes permanent. So once we are able to retrain that brain and create those new pathways, it becomes a permanent thing. So it's not something you necessarily have to do the rest of your life, but some people need quite a bit more than others.
Give me an example, if you have one, where a patient has come to you after being on medications or trying every other method of treatment under the sun, and suddenly they come to you and finally they see perhaps light at the end of the tunnel where there otherwise wasn't any.
Right. I have a few great examples. One is a 23-year-old male who had been on medication since second grade for ADHD, and changing medications, changing doses, everything is not working. His mood just worse and worse as he's getting older. So his mom said, we need to do something. He came in, he did 30 visits with me, and under the advice of his prescribing doctor. So this is the thing, I will never tell anyone, hey, time to come off your medication, brain core neurofeedback's working. Definitely not doing that. So reports are given to the doctor who has prescribed, letting them know this is what we're doing. Sometimes side effects of the medication start to appear. So maybe it's someone who is taking an ADHD medication, they start neurofeedback, they start having muscle aches and pains, ringing in the ears. These are all side effects of medication showing that it could be too strong now for that new, better working brain. For him, he did start to experience side effects, so they went back to the prescribing doctor, let them know this is what we're doing. Could you give us a lower dose? So he went from 60 milligrams of Vyvanse, and he is now completely off his medication.
That's incredible.
Yes.
And you see a pretty good bit of that.
Oh, definitely. Anxiety medications, insomnia. Insomnia is one of the greatest ones to work with because so many people are, having so much trouble sleeping, usually because they're over-aroused and overstimulated throughout the day on their cell phones, on their laptops, everything. So they don't know how to actually calm that brain down when it needs to be calmed down. And that's the whole point of neurofeedback, is training the brain to work in the appropriate speeds at the appropriate times.
It sounds like if my wife's listening, she may be making an appointment for me as we speak. Let me give you an example of something I encounter in my practice. So I have a client come in, car wreck, relatively moderate to high rate of speed. There may be, airbag deployment, maybe no loss of consciousness, maybe a little loss of consciousness, but the client or the patient would be diagnosed traditionally with post-concussive syndrome, headaches, some cognitive issues, perhaps some mood disturbance. Normally, I would take that patient or recommend that patient or client go see a neurologist. The neurologist may run them through like a computerized neuropsych test and try to give them some medication and just basically tell them, look, at some point you're going to get better. Time will probably heal this. More often than not, it will. So I take that same client. I recommend, hey, why don't you go see Melissa, do some neurofeedback. How can you succeed if, the neurology fails, or how can you supplement that treatment in a patient that has been suffered a mild traumatic brain injury and has those symptoms that I discussed?
Right. I actually say that a lot in my office. We met earlier, and I work with quite a few rugby players who have had concussions. So there is actually a natural process that needs to happen for the brain to do its healing. So we really don't want to do any neurofeedback sometimes 6 to 9 months after concussion happens. So like you said, there is some natural healing that needs to happen before we even start working with those clients. So most of the ones that I see that have had a mild concussion or traumatic brain injury, it's usually a year after their concussion has happened, and they're just now experiencing this cognitive, decline in school or in work. And so I recently finished up with a woman that was in a car accident, and we used neurofeedback, and she used neurofeedback, all the notes and the QEEG before and after mapping in her case for the accident she was in. And hers weren't necessarily for mild concussions, but more of the anxiety and stress that the car accident caused. But back to the original question, yes, the neurofeedback can absolutely help strengthen the brain. So when an injury happens in a car accident or on a sports field in a soccer game, there's a lot of damage that could be done, but neurofeedback can help. The more signal that's sent down those neurons that were damaged, the more they can strengthen and grow. So it can definitely help with a lot of the symptoms that show up.
So I had a client where they had gone through a what's called a CNS vital signs battery, a neurocognitive test, and I wanted to know how it was done. And so I submitted myself to it and did it, and the doctor pretty much said, you probably need to see me before you get out of here. I didn't do very well on the test. But, I work in a profession, doctors work in a profession, accountants, any type of cerebral job where, your analytical skills are very important. Do you think that your neurofeedback can provide a service just for the everyday individual who just wants to improve their cognitive function?
Yes, absolutely. We would call that peak performance. So I've actually worked with a few CEOs and a hedge fund manager that just really wanted, that's a very stressful job. A lot of us have very stressful jobs, so they need to be at their peak performance. So he actually came in, did 20 visits, saw a great improvement in his everyday life, getting things done. So neurofeedback could absolutely be used even if there's no symptoms that are present.
And what types of things would I, if I came in and was tested and had some improvement, where might I notice those improvements in everyday life and my job?
A lot of them show up, first of all, in the sleep. So sleeping is so important for our brains to heal, obviously. So when we work out more, we get sore, we get tired. When we do neurofeedback, a lot of the clients do get tired. So they're sleeping more. Even if they didn't come in for insomnia, they see a great improvement in sleep, just maybe even dreaming more, things like that. So sleep's one that many have told me they've seen improvement in. Being able to refocus faster, so even just kids as young as 5 and 6 years old that are not able to focus in the classroom, they're still maybe getting sidetracked or, their attention is being taken elsewhere, but they're now able to focus back in and get there faster than they were able to before.
Dr. Capaferi, you feel like espousing any of the virtues of neurofeedback in the time we have?
Big fan, still do neurofeedback in the office. There is some characteristic changes we see on the QEEG from somebody that's had an MTBI, mild traumatic brain injury. Agree 100% with what Melissa said. It's hands-off usually for 9 months to a year. Then we'll redo the test. And we do have a lot of people come in just to be better at what they do. She talked about executives, but also athletes, eye-hand coordination, being able to focus better, improves everybody's skills.
Well, I want to thank both of you again for coming in today and joining us on the Law and Medicine program. If you'd like more information about Dr. Capaferi and his practice, you can go to his website, www.precisionpainreliefcenter.com. And for more information on Melissa Hergert and her neurofeedback practice, you can go to bemywellness.com. As always, if you want to learn more about my legal practice, specializing in wrongful death, personal injury, and workers' comp, you can visit our website at princemay.com, princemay.com, or give us a call at 678-534-1980. Thank you very much.
Thank you again for joining us and our guests on the Law and Medicine Show.